And we promise even if we finish, we will start, you'll still have an hour and 15 minutes. Okay, cognitive exam, it's administered by the American Board of Family Medicine, and you all know you have to take it now every 10 years. It's the same exam whether you're taking it for the first time or for the 6th or 7th time, and all candidates have to select, in addition to the general questions, 2 subcategories, if you will, 2 modules. Now, what's changed a little bit from 2011 on is the examination process, in the sense that you have 3 3-year cycles, and you have to have accrued 50 points in each 3-year cycle in order for you to stay board certified. And the way they break that down is a SAM, or simulated patient, is 15 points, and then a module, part 4, which is a quality module, is a 20 points. So any combination to accrue 50 points is okay. So if you think about that, you've got to do at least 2 SAMs and a quality, or 2 qualities and a SAM in a 3-year period in order to total those 50 points. And for all of those incoming first-year residents, they get to do this starting this year as well. So they have to accrue maintenance and certification points for their residency in order for them to sit at the end of their 3rd year. You have to be continuously licensed, and it must be valid, it has to be unrestricted. And again, you have to keep doing those 3-year cycles in order for you to meet those requirements. If you don't in that 3-year cycle, then they actually will consider you no longer board certified, or you will not be listed as board certified until you make up those requirements. So that is a new change in the way things are. And so you have to go through these 3 cycles, and then in year 10 is when you can sit for your cognitive exam. The exam currently, as it stands now through next year, will be 120 questions and then 2 module books. And then the afternoon, there's about 160 questions, 20 of which are research questions that aren't scored. And you can see the time there. I have heard from Jim Puffer at an update on the boards that in 2014, they're going to do away with a number of questions and do simulated patients, very similar to some of the national board certification exams, and supposedly a higher fidelity than the current SAMs that you work through on maintenance and certification. So get your exam in by next year, because in 14 it changes, more likely. Here's the example of the schedule. Now you could take all of the breaks you want, or you can actually work straight through in both the morning and the afternoon. So you see lunch is optional. So you can certainly, but they won't give you past 5:30. So if you try that, good luck. They'll tell you that the test is over. So you can take those things, and again, here are sort of the modules, and we're not going to spend a ton of time, but ambulatory, child and adolescent, geriatrics, women's health. It gives you the idea of what's on those. Maternity care, urgent or emergent care, hospital medicine, which is a relatively new one, and sports medicine. So again, depending on your practice and what you do or don't do, it would behoove you to sort of accent your strengths. Now, the board is really good about letting us know how they're developing the exam. So this is the content. So you can see that it's like, well, I don't do much cardiology. Tough. It's 9% of the exam. And if one of the ways we structured this course was we looked at how much content per topic, it's based on this template. And you can see that even if you don't do, was it OB, there's still a number of questions that you're going to be required to know. And then the modules make up the other 26% of that. So this is right off of their website in terms of their blueprint. So if you go, gee, well, I don't do musculoskeletal that much, it's still 9%. It's still required content. And then again, this just shows you, sort of, I apologize on the side, the exam results. And the 2 things that you want to look at here are repeat takers. That's the people that didn't quite do well the first time and are taking it. Their pass rates are significantly lower than the first time takers, or people that are recertifying. And there's a couple other things in there. If I talk about the 2011 and 2012 exam, you'll see that there's a little bit of improvement in terms of total pass rate. I think it's about 87% for the 2012 through the April exam. So obviously does not include the November exam. Now, how do we develop the exam? Well, there's again 40 writers. Each of them has a 3-year commitment. They must submit 20 questions. Now, they're not all being used, but they have to submit 20 questions per year. and they're edited by the editorial staff. They're then run through a psychometric testing, making sure that they make sense. And then the final draft is approved by the committee on the board of American Board of Family Medicine. So to put together one exam takes about 9 to 10 months. So you have to realize that, so anything that's on that exam is as much dated as 9 to 10 months. So the exam is going to ask, what's the latest thing that came out of New England Journal last week? You realize they're about 10 months before that. And then how do you set the passing threshold? They actually take ABFM diplomats, people like you, and they look at them and say, please rate the difficulty of this question. It's called a modified Angloff technique. And they say, okay, so on this question, we think 80% of the family docs should get it right. Well, on this question, that's a really tough one. We think only 10% are going to get it right. And so each question has a modified, if you will, threshold. And these people are submitted at random. They're usually asked because they did pretty well on the exam. But they try to include a sampling of academic, practicing, people that are doing urgent care. And so they try to get a spectrum across the practice that we do as family medicine. And then they're going to ask you, what do we think the minimum standard is? And for the last 2 years, and again for this year, the 390 is the passing threshold. So again, you have to look at that. You need that score of 390 or better in order for it to be awarded a pass. And that's probably going to be through 2013, but it then may readjust. So they, again, look at that each year. Most of those, after the exam's been done, they're going to look at that, and then the reports are getting released. It says 6 to 8 weeks. Well, I think the turnaround time has been closer to 4. So they've actually got this down pretty well. This is sort of dividing the exam results, and it'll show you this person did quite well, 97th percentile. I think that's Bob Lorenzer's score from last time, our former course director. And you can see it break it down by system or by the discipline. So is it cardiovascular? Is it? Then you can see how you did compared to the rest of the module test takers. And really the thing you want to see is, dear doctor, you have passed.